materials and information provided are for informational purposes only and are not intended for use as diagnosis, prevention, or treatment of a health or other problem, or as a substitute for consulting a licensed medical professional. Some concepts presented herein may be theoretical and have little or no scientific substantiation. Users are advised to conduct their own diligence.
Welcome to
Mike's up.
where you'll learn about a variety of life-enhancing subjects. Today we delve into holistic healing and whole food nutrition with the natural health authority Jason Eagle of Strategic Healing. And now here's Jason.
Indeed, here is Jason. Hi there, everybody. This is Jason Eagle, your natural health authority, with another show on health. You can see me live right now on Facebook, my Facebook page, Strategic Healing. I always post these radio shows, so it goes on live. And then I repost them also later on YouTube. My YouTube channel is Jason Eagle QRA. And there you can kind of go back and see me and rewind it and say, what was that again? So my office is Strategic Healing. I'm in Auburn Hills. You can call my office if you want to schedule appointments or ask questions or things like that. And that's 734-985-5891. And today we're going to do a show on what to do when. Now, there's some questions that I've had from people that normally I would answer, like, and I ask for, give me some questions. But the questions that people have asked, especially the one on Lyme's disease, and I'm not ready to talk about that yet. That's a can of worms, and I need more preparation because that one's going to be a good show, part of a show itself. So I will answer the question, especially about Lyme's disease, to one of my listeners. But you're going to get the real. So if you want to hear what I think about Lyme's disease, and Lyme's disease has really changed, and there's some big news on what it is and what's happening. So I will answer that question. I don't want to do it. I wouldn't do it justice today. So later, one of my shows, I'm going to talk about Lyme's disease. But today, this is Jason Eagle, your natural health authority. We're going to talk about this kind of laundry list of what to do when. Basically, when things happen, we definitely have the emergency room that we can go to, and we have all this other type of stuff. But, a lot of times it's even if let's say something bad is happening in your life, sometimes, like I've gotten injured out in the woods and or whatever, and you gotta do something there, right? So acute injury is one thing, and I'm just going to touch on that a little bit, which is acute injury. Like the acute injury is when I smashed my finger into the smoker, and this was right in the middle of what we've been going through, and I couldn't go to the emergency room, and I couldn't go to the whatever care, but I would have. But again, they would have said, there's nothing we can do, because I did lose the nail, but it healed very, very quickly. And these are the things that I did. So within acute care, they always say this. Remember this. It's called RICE. RICE. If you spell rice, that's what, and it's in that order, which is, okay, what could be even acute? Like you pull a tendon, you're out there and you twist your ankle or something like that. Rice is R, and that starts with rest. Immediately stop doing it, right? Okay. Again, if you're on the run and you got to keep running because an animal's chasing you, you can't rest until that's over, until the danger's out of the way. But if you're out there and you pull a hamstring or something like that in the middle of doing, some outside work, stop right away. Don't you? Because many times I've seen so many people I just kept going, and then you really made it worse. Or let's say you're out running or something like that, and you twist your ankle. Stop right then and there, and don't go any further. And either if you got to hobble your way back, or get on your phone, call somebody, have someone come pick you up, whatever. But that's what rest means. Go inside, lay down, go inside and stop doing whatever you're doing. I stands for ice. Immediately put ice on it. You know, even if you're out and about, there's ice machines all over the place. You can stop at a roadside or something like that. But usually that means you're close to home or the office, and most people have ice around. And even if, so ice is something that's very available, and you can pack ice around it. I'll tell you, the gymnast, my wife is a competitive gymnast, and also I have been one of the people that has been there to help. One time I actually was one of what you would call the medics, and had to build a kit and everything like that. And one of these you'll see at like events, especially like say sporting events like track and stuff like that. They'll always have ice available. They will have a big cooler of ice and then these bags. And what they'll do is they'll just pack ice around it and then like take say saran wrap and wrap it around that. So you'll see these girls and boys walking around with like on their knee like a great big huge bag of ice, because they immediately twist it or something like that. And so you can pack it around the ankle, you can pack it around the shoulder, that type of thing. This is what sports people do, is you put ice on it immediately and then pack it around there. Then C stands for compression. Again, if it's going to be injured, it's going to start swelling, going to get red and hot, and that's what the ice does. Is it slows the blood flow down, it reduces inflammation. Inflammation is what causes pain. But then, like I said, they'll put an ace bandage around it with ice on top of it so that it's under pressure. If you twist your ankle, you twist your knee, twist your elbow, something like that. Compression is so that it doesn't swell up anymore. Because if it swells up more beyond what it's, basically it keeps it under control. And then E stands for, so remember, this is rice, R-I-C-E, and the E is elevation. If it's your knee, lay on the couch wrapped in ice with some compression on it, and then have it above your heart. So like have your laying on the couch or laying on the floor with your knee, leg on. So if it's your ankle, your foot, your knee, this type of thing, you're laying on the floor and you look like an L shape. So it's way above your heart. If it's your arm or your wrist or your hand, or like it was my finger, you lay on the couch with it like above your head. So like propped up on pillows or something like that. Or like when you're laying in bed and it's up against the headboard, and you keep it like that as much as you can. The elevation will then drain the bad blood out of it, the damaged stuff, and then bring stuff, because that's the whole thing, is the body's got repair. So, and then here's the other thing, and I talked about this and I'm going to talk about it again. I happened upon this and it's really worked for me. It's what I call, there's another thing that it's called, and I don't remember, but this is what I call it. It's called controlled recreation. Basically, okay, let's say you cut your finger. For me, I slammed my finger in that thing, and I went in and stuck it in a bowl of ice and did my elevation and wrapping. But then very quickly as I could, I went back to the scene of the crime, right? I went back to it, and I did that same action, but I didn't drop it on my finger. So in this one, which is I held my finger, which was my right middle fingertip, and I then closed with my other hand, controlled it and closed the lid very lightly and had it just touch it. So I didn't just let it happen. So let's say I would have cut my finger. I would have, with the Band-Aid on it, I would have taken that knife, and not the sharp edge of that knife, but the back edge of that knife. It doesn't matter. But the point is people are going, this is crazy. This is nuts. Oh, okay. You'll see the pain go away immediately. Because see, this is anytime we do damage, like that type of thing. Twist it. So go back to the place where you twisted your ankle, right? And then touch your ankle to that place. Or, again, go back to the scene of the crime and do it 5 times, 5 or more times. 3 is not enough, about 5 times. People go, that's weird. No, because what happens is your body stores memories of the trauma, and it stores memories in that place because your brain will remember it. There's an image. You make a mental image. That's why a lot of times when you've had, let's say, a bad... I remember, okay, I'll give you a good example. I remember, and see, this can even be other people's injuries. This is a good example. My best friend, when he was going to come over in the morning one time, he was running around the cars and he fell down and he just happened to slip underneath, and the whatchamacallit, the license plate this is back in like the early 80s. He cut his chin. he slipped and fell and just right underneath it. And I remember waiting for him, and then we went and checked, and that's where he was found, and blah, blah, blah. So, but I remember, he got bandaged and everything, and I think he got stitches or whatever, but it was gone. It was healed. But I remember for literally years looking at a license plate like that edge, and you know how that when someone cuts themselves, you get these pricklies, or you get these cold shivers. Ooh. And it was just even though it didn't even happen to me. So let alone if something happened to you, your body, your eyes, everything, it records that. And what it does is it blocks the level of healing. It blocks the level of healing. So again, if you can go back to that thing, and then take your body back to it and say, see, it's all right. There's nothing wrong. You're healed. Everything's going to be all right. It's over. There's no reason to be afraid of it. What it does is it reprograms your brain, and it then releases the full amount of the healing as well as the full amount of pain relieving. Because when your body relieves pain, you're sending your own hormones, your own drugs to relieve pain. We have your own opioids, or let's say the opiates. We produce that. We produce those things, the endorphins and all these other things, like when they say, oh, you're in shock. When a person's had a traumatic injury and they are in shock, they're not in pain. And it's almost as if like they are on morphine, because you produce your own morphine. The endocannabinoid system is another thing too, that our body releases these stored hormone-like things, and we give ourselves pain relief. So, but again, this recreation, it's strange how it works, but it works, I guarantee you. So that's another thing that you can do. So setting that aside, let's go into some of the other things, which is, these common things that happen to people: sinuses, digestive, swelling, headaches, eye strain, anxiety, back pain, bleeding gums or periodontal disease, immune system reboot, blood pressure, earache. These are the real common things that not only you but your little kids also face. These are very, very common things, which is usually we have some sort of something inside the medicine cabinet. But I'm going to tell you what are the natural ways to do it that work as good or better and have no side effects and have no repercussions. And they're getting to the root of what's going on. The gallbladder attacks, insomnia, skin conditions, prediabetes, and then even this last one, which is couch potato, right? Maybe I'll get to all these today, but like what I'm calling this one, which is the COVID-15, or what people have called the freshman 15. You gain 15 pounds when you're a freshman in college, first year, because all your eating is different, and with your friends and all this other stuff, and you don't have the same level of activity. Well, this is what COVID has been. People have gained the good 15 and plus. What do we do about this? Like, I want to get back to my better weight. Let's start with the sinuses. Everybody's got sinus. I'm a little sinusy today, a little plugged up. Okay, so if a person is, and the sinuses can go different ways, which is one, you're stuffy, but it's dry. It's a dry stuffiness. What do you do for that? Or let's say it's stuffy and it's snotty, but it's not runny. You're just plugged up with this thick type of mucus, and it would be better if it were runny, because when it's runny, you can get it to come out. Stuffy nose, a stuffy dry nose, we use what's called NAC, N-acetylcysteine. N-acetylcysteine, which is a supplement that I have, and you can contact me to get these supplements. Very soon, my really cool e-commerce site is going to be on, and you're going to be able to just go right on your phone and go click, 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 and have it shipped to you, and boom, ready to go. But, you're going to see a big, huge list of stuff that you don't know. And I'm going to tell you what this stuff is. And it's very, very, it works. This works quickly. So NAC is these pills that you can take, and it helps to detox the liver. But what it also does, it will get clogged up sinuses to start getting runny again. Now, a lot of people will take, let's say, some over-the-counter medication. They just want it to go away. No, what you want to do is you want your body to produce the sinus, to produce the mucus, to then clean this out, because mucus is, let's say, a natural reaction to you breathed in something, whether it be dust or even viruses or stuff like that, and it made mucus in order to be like a straitjacket and it throws it on there. So it grabs, so it can't get into your body. If it goes and it gets stuck like the blob, so, mucus, that's what it looks like. It's like the blob. And it grabs onto things. And mucus, especially your nasal mucus, is anti-infective. It literally will kill bacteria, virus, molds, all these different things on contact because it's filled with what's called macrophages and all these. They are your immune system. So it's not like looking at your sinuses is like, oh, dumb body, I wish you weren't doing that. No, you should go, thank you, body. Good job. Like, you're on point. You're doing what you're supposed to do. But it's really annoying when you have to be stuffy. But let me tell you, people should suffer a little bit more symptoms than they did before and then really fix it. Because before, most people were I can't be like this at work. Well, a lot of people are not going to work right now, or they're working at home on Zoom and stuff like that. And as I said, ladies, don't put your makeup on if you don't have to. Guys and gals, don't take your Sudafed or whatever if you don't have to, because again, you're suppressing your immune system with these things, and it would be better for you just to ride it out. And again, your red eyes and stuffy nose is not a big deal to Zoom, because everybody sounds stuffy on Zoom. So again, hiding symptoms is one of the worst things you can do. Now, again, if it's really, really affecting your life, there are also natural things that you can do. But with these immune system problems, you want to let your body get through it. So this is Jason Eagle, your Natural Health Authority. I'm going to take a commercial break, and I will be right back.
If we've learned anything from the recent medical crisis, it's how extremely important it is to maintain our good health. Diabetes, asthma, pain, and other underlying conditions weaken our ability to stave off viruses and heal even minor scrapes and cuts. This is why it is so vital to heal, not just treat, chronic health issues. It is possible to overcome underlying health issues and return to a strong and healthy state, and it can be done naturally without the inevitable side effects of medication. But first, you must make that choice to be healthy. Your next step is to contact Jason Eagle of Strategic Healing Center at 734-985-5891. Jason will get to the heart of what is really causing your underlying health issues. Then he'll create a customized plan that will get you back to your natural, healthy self. Get on the path to better health. Call 734-985-5891 to make your appointment with Jason Eagle of Strategic Healing. Or go online to wrdt560.com/askingtheexperts and click on Strategic Healing. And Mike's back up. 60 WRDT every Wednesday afternoon at 1 for healthy living advice from Jason.
Hello there, we still there? All right, I think I'm still there. Okay, so yes, this is Jason Eagle, your Natural Health Authority, and we're still talking about sinuses. So today is the show on what to do when this happens. What do I do? So sticking with sinuses, okay, let's say you got a runny nose. Let's say it's just, oh man, this thing is just, and I can't stop blowing my nose, and my nose is all red, of which you can put olive oil on, those types of things. But cayenne, make tea. Tea is a very simple thing. Hot water with some cayenne pepper, some lemon. Some of your herbal teas, you can do that. But the lemon provides the vitamin C. The the cayenne pepper will help with the sinuses that are runny in terms of, yes, it tends to, like, again, when a person eats something kind of hot, their nose gets runny. What it will do is it will speed the process up so that it can then knock it off. And then the other thing you can do is, since your sinuses are runny, that means your body's trying to get the stuff out of these cavities, your sinus cavities. Well, you can help that out, which is you can wash your sinuses. This is what the NetiPot is. The NetiPot, you can go and you're basically sticking this thing up your nose. They make one that actually has like a pump on it, and you can put just straight water in there. You can put water and some salt. Because salt is also an antibiotic, basically. Salt will kill things. Salt is a preservative. So we're talking sea salt. You use good sea salt. You can also use this stuff called xylitol. So mix that in the water. It's a powder that you can get at the health food store. Xylitol is one of those sugar substitute things. It's a natural sugar substitute, and they make it actually from birch bark. The thing about xylitol is what xylitol is it kills bacteria, mold, viruses, these things. It kills the bad guys, but it rebuilds your immune system. It's actually a prebiotic fiber. It helps to support, because the sinuses, those are probiotics. Those are living things, and you want the good guys living in there. Just like you want your yogurt in your gut, you want good stuff in your sinuses. So that helps to repair the sinuses. There's this other nasal spray, instead of using the Afrin type of stuff, which is, again, it's a drug chemical type of stuff. They make another nasal spray that's what's called Xylitol, and it's purified water with saline solution water with this xylitol mixed in it, and you just go squirt, 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 breathe it in one nostril, squirt, 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 breathe it in another, and do that about 4 times a day. And what it does is it gives the effect of, let's say, a nasal spray, like many people go to of like a nasal spray. But what it also does is it's also cleaning stuff out, because it washes it out, but it washes it with like a liquid that is a super sanitizer as well as a healer. It helps to stimulate and rebuild your natural immune system in your sinuses. If it's an allergy, a lot of time an allergic to, let's say, hay fever type of stuff, right? And that's where the AloeMannan comes in. The AloeMannan is a particular type of dried aloe pill. And what you can do is you can just chew on a couple of them and hold them under your tongue, hold them in your mouth, or screw them open and pour them on your mouth. And that immediately, I've seen people that have normally take, let's say, an Allegra or something like that, or let's say an allergy pill. This works better than, like you would use that, which is it helps the symptom out, like a histamine reaction. It helps. It's an antihistamine, but it's natural. And then there's another supplement called Allercleanse, and Allercleanse can be taken when you have an allergy. Now, sometimes sinuses is also, it's a food. You're having a food allergy. You ate something that your whole immune system is going haywire over. And if it's a food one, then that's when you do the hydrochloric acid. Now, hydrochloric acid is for helping to digest your food. So sometimes you're not digesting that food very well. We ate like a food poison or something like that, and the HCl helps to kill it off and burn it up, essentially, so that it doesn't turn into the body's all these other symptoms, okay? Now we get into digestive. Let's say, I was going to go for a Tums or something like that. One of the best things again, the HCl. If you got a burning stomach, let's say an acid reflux, or you ate something that didn't really sit very well, right? You take some hydrochloric acid. You basically take 2 or 3 or 4 or 6 of these pills, and you can even take them on an empty stomach. If you got a good strong stomach, you can take 1 or 2 on an empty stomach. Here's another thing that you can take. Apple cider vinegar. It's acetic acid. It's not hydrochloric acid, but it's very soothing. Acetic acid is and we used to tell people, well, just pour some apple cider vinegar in some water. There's a lot of people that hate the taste of apple cider vinegar, especially kids. So you can take it in a capsule form. And if you're a person that tends towards eating late at night, or let's say waking up with heartburn, what you do is you take the apple cider vinegar before you go to bed. Basically, about an hour before you go to bed, you can take 2 to 4 of these apple cider vinegar, and it sits in your stomach and then goes into your digestive tract. And it's an acid kills some of this bad stuff, but it's very soothing. And one thinks, that's backwards. If it's acid, why would I take an acid? Well, again, most acid reflux or that sour stomach is because you don't have enough hydrochloric acid, and now the food is starting to ferment, and it turns into a byproduct of fermentation or rotting food. And I don't mean good fermenting like good pickles. This is like rotting, like a garbage can. It starts rotting, and it starts producing all of these other things, including feeding these bad bacteria that they then produce waste products. So when you add more hydrochloric acid to it, or more acid, it's actually soothing because it beats those guys back. So again, the Gastroven tea, which is the stomach tea, is these capsules that you can instead of swallowing them, you can actually open them up into hot water and let them steep for about 10 minutes and drink that. That is ginger and a number of other things, and it actually coats your stomach. It really is very, very soothing. And if a person takes the hydrochloric acid or the apple cider vinegar and it makes it burn more, then do the Gastrovent tea and then the hydrochloric acid and apple cider vinegar. Enzymes, meaning the digestive enzymes. Sometimes we just need more enzymes. So that's the Digest or the Digest SP. Sometimes it's because we're burping the stuff up. Mediclay. Mediclay is also something I was going to say for sinuses. Because sometimes our sinuses and our guts and all this other stuff is we're having a reaction to a toxin, to a poison that's inside our body. The Mediclay, which is you open 2 capsules, 1 or 2 capsules into like an 8-ounce glass of water and drink it down. It's a little gritty on your teeth, but that's fine. And what bentonite clay does, especially this type of bentonite clay, is it's like a magnet to all forms of toxins, including metabolic waste products from, let's say, bacteria and stuff like that. So cleans up the plastics, cleans up the heavy metals, cleans up the chemicals, but it also cleans up these metabolic wastes of your overreactive immune system, as well as the junk that, say, these living life forms are making. So it really is very, very soothing and just kind of, basically turns off the ticking time bomb. It's a good go-to, always knowing that. Sometimes, a lot of times we get, let's say, when people have, let's say, digestive problems where they got the bloating, like the beer belly boys. The beer belly is oftentimes what's called Candida, and Candida is a yeast. Literally, you're growing mushrooms. You're growing bread. You got the bread belly. You got the beer belly. Beer is bread. So, but what does yeast feed off of? It feeds off of sugars. So reduce your sugar intakes, maybe go gluten-free, but also there's some basically killers for that, and that's garlic. Garlic it's antimicrobial, it's a broad spectrum, basically natural antibiotic, but what it does is it kills the bacteria, especially the nanobacteria and the gut bacteria. So the beer belly type of thing is taking, or let's say the food that we ate that you blow up, and you go like a lot of times that's not only gases, but and again, a person that eats something that you blow up and you get that belchy or pooty, the gas that you're producing. Now, a good rule of thumb is if you have, let's say, gas, like, the bottom gas, and it smells, that means that if it's really stinky, that means you're not digesting proteins very well. Okay, so that there's something in the meat that you ate or the proteins that's not digested. I know in our family, we call them the pork farts, right? Some people don't digest pork very well because you have a very specific type of enzyme that you need to digest pork, and many people are deficient in that enzyme. And so it doesn't digest completely, and so it creates these really smelly gas. That's protein. Now, if a person has gas, but it doesn't smell, then that is a carbohydrate that they're not digesting. And again, that's the yeast. So the Allicidin helps to bring that back. Salt. You can always take some salt. If you got some digestive problems going on, take some sea salt, like a half teaspoon, and put it in a big glass of water. Drink it down. You may feel that I feel a lot better. Magnesium. A lot of times, too, we have people with digestive, it's nervous stomach, especially right now. The nerves are tight, man. And nerves are like, even for children, sometimes when they eat and then they throw up, because they got a nervous stomach. And children can take all of these things too. This is all safe for children. Magnesium, if you have a nervous stomach, a nervous belly, or even going towards constipation, meaning it's not coming out, magnesium helps to loosen your muscles. It's basically it's Valium for all of your muscles. It's a muscle relaxant, and your guts are all muscles. It's tubes of muscles. So a magnesium helps to relax. Again, another way to do magnesium, you got people with a really bad belly, take an Epsom salt bath. Make a hot bath and then put some Epsom salt in there. Probably about, between 2 to 4 pounds of Epsom salt. Not 2 cups, 2 to 4 pounds. If your muscles are super, super tight from working out or, doing the, whatever, or some days even doing the laundry, makes you sore. You can always take an Epsom salt bath, and that helps to relax your muscles. But again, you'll see it relaxes the digestive muscles. Now, a lot of times people have swelling in the legs. Let's start with swelling in the legs. Your legs are ballooning up and it's this fluid or edema. That is the kidneys. The kidneys are not filtering out and a lot of times too, dehydration can. So one of the very first things in almost every single one of these things, drink some water. Drink some water. A lot of times it's water, and sometimes add a little bit of salt to your water. So swelling, again, especially if it's kind of, but I thought salt made me swell. Yes, too much salt can make you swell, but not enough salt will make you swell as well. Okay, cheap, easy. The Renoven, which is for kidneys, and then DHA. So sometimes the essential fat, we're low in essential fatty acids, and so we can't get our kidneys to filter correctly. Your kidneys are jammed up, and if your kidneys start to dry out because of being dehydrated and not having enough essential fatty acids like a fish oil or DHA or avocados or these things, what happens is your kidneys start to jam up, and when they don't filter very well, it will clean the fluid out of your upper body, but it won't clean the foot. So when you see people where their legs are all big and swollen, but their upper body looks, now you can have people that swell all over the whole body. And that tends to be a little bit more adrenals, okay? But the adrenals are part of the kidney system too. Magnesium, as I said, swelling. Sometimes the muscles are so tight that it won't let the fluid come out of what's called the interstitial fluid. Then another thing, swelling. Let's say the joint swelling. The people that wake up with the achy joints, what you would call arthritis joints. There's an enzyme called Phytozymes. These are what's called proteolytic enzymes. They digest protein. You can take them to help you digest. So remember I said the people that get, let's say, gassy, that smells, you can take the Phytozymes with your food. Or there's another one called protease, and you can take it just before you eat your food so that it goes and it helps you to digest protein. That's what protease. But here's a secret. If you take protease on an empty stomach, so as soon as you wake up, before you eat anything, you take 2 of them. And then sometime in between, about 3 hours after your breakfast, take another 2. 3 hours after your lunch or dinner. So the empty stomach is window is about 3 hours after the last meal. If you take it on an empty stomach, now this stuff, I've had a lot of responses for this one. People actually heard me talk about this on the show. It acts like prednisone, which is those steroidal type of things, meaning people have to go on these shots or people have to take these pills to reduce that joint swelling, that arthritis, okay? I've had so many people that have had decades worth, and they've been on the prednisone or the other anti-inflammatories. They did the Phytozymes, and they were like, this is a miracle. It's a huge difference. And I actually had a girl that's had a lot of joint pain. She went on the Phytozymes, just like I told her. She was astounded, and then she ran out of the pills and then forgot about it, and then all of it came back. And she now goes, okay, this stuff works. It works so great. The Phytozymes is something that works so well on joint pain. Now, they've talked about glucosamine and chondroitin. That helps to rebuild the cartilage, but a lot of times you don't want to rebuild it. You need to clean it out. And again, you got to get rid of the old junk, the old broken down ones. So then we move on to headaches. Headaches, again, I'm going to go back to one so simple. Dehydrated. How many people where you've got a headache or even starting with, let's say, a migraine, you really just didn't drink enough, and you've been drinking a bunch of coffee, or you've been drinking a bunch of diuretics, and then let alone not drinking enough water, or drinking a lot of water but not taking any salt because someone scared you from salt. If you don't have enough sodium in your system, or the sea salt, you can drink all you want and it will go right through you. So people say, I drink a ton, but it goes right through me. Are you taking your salt? No, they told me not to take salt. Salt is bad, right? If you don't have enough salt and you dilute your salt with all this water, your cells are hard and dry, like a dry sponge, and it won't absorb the water. But if you put some salt with your water, you have an adequate amount, and an average adult is about a teaspoon a day of a sea salt. If you were to measure up all the salt that you had on a daily, about a teaspoon, that's how much a person needs, right? So, but when you are dehydrated, when you add salt to the water, now the dry sponges act like a sponge again, and they suck the water up, and now you become dehydrated. Well, one of the most common symptoms of dehydration is your brain literally starts to shrink and it starts to pull away, and it can ache your brain. You can have like a brain ache. So that's the first go-to, is drink some water, okay? With salt. Magnesium. Again, sometimes the headache is you feel a person who says, I really got a headache. Feel their neck muscles. They're like a rock. And oftentimes what it is because your neck muscles are so tight that it's squeezing your brain. It's squeezed because your brain, the blood flow and the cerebral spinal fluid has to go through the neck because there's a hole at the base of your skull, and it all like a flower pot. That's what your skull looks like, is, like those terracotta flower pots that has one hole in the bottom so that the water can come out of it. That's what your head looks like. It looks like this, globe with a hole in the bottom of it, and that hole's right in the center. Well, that's where the spinal cord connects, but that's also where all the blood has to go to. Now, there's some that go through your face and go in through the bone, but the main channels have to go. That's how the brain gets fed. So the muscles, if the muscles are super tight, it's pinching, and it's like an anaconda, and you literally are a boa constrictor on your own brain, and you're squeezing it. So, as I said, magnesium is this muscle relaxant. I've had so many people who they did their magnesium, and this magnesium that I have, and there's lots of different types, but it's a powdered one that you mix in some warm water, and it has a watermelon taste. It's nice. You can take a single dose. You can take a double dose. If you are constipated, do a double dose, but stay close to home, because when you take what's called a max dose, a super dose, more than what you need of magnesium, it causes loose stools. Now, that's not great if you want to get in the car and drive to work, but if you're constipated and also you really need to get stuff out of you, here's one of the other telltale signs of a headache, is it's related to bowels, especially for children. If you get little children that say, oh, I got an headache, they're constipated. And so giving them some magnesium to get them to go poo, or like, say, for instance, even an enema if you have to, even those like fleet enemas. I can't tell you how many people, especially with migraines, which is, if you get a migraine for some people, you're going to be stuck with it for days, and they have to be in a dark room and they're nauseous and stuff like that. Well, sometimes the brain is toxic because the colon is all jammed, and all these super bad toxins are just polluting the brain, and the brain is trying to get out of the skull because it's being poisoned. So clearing the bowels out helps a lot of times to get rid of a headache immediately. Another thing you can do is just noni. These capsules of noni, which is this noni fruit. It's a tropical type of fruit, but it's really good for digestive issues. And you can literally take, let's say, a person who's, instead of taking, let's say, a Dulcolax or something like that, you can take 20 noni. Just, take them as capsules. You can even open them up and brew them as a tea. So let's say 5 to 10 capsules made as a tea, and then let it steep there for about 10 minutes if you don't want to take the pills. And noni tea works great as a really good anti-constipation type of thing, and it doesn't create a dependence like a lot of times laxatives do. Eye strain. You get a lot of people, they have to work, and especially now when people are going, I stay at home and I'm on a screen, or you got kids that are having to be on the screen. It'd be better for kids to be back in school, but now that they have to be on the screen. So now people are spending a lot more time on the screen, and, they're basically doing the COVID Netflix, which is I binged watched the thing, and now my eyes hurt. Well, I did a video on this. You can look at my YouTube channel, Jason Eagle QRA, and I did a video. It's called Screen Sickness, there is something called screen sickness, which is the screens, all of the screens that we're looking at, they are emitting this blue wavelength, and this blue wavelength, oftentimes the eye strain and the brain strain is because these blue wavelengths are getting into your eyes, and they're programming your brain. And what they're doing is they're scrambling neurotransmitters, and in particular, they can scramble what's called all of the good hormones. So melatonin is one of these things that melatonin is often said, oh, you don't sleep very well. Melatonin is something that helps you to sleep, because melatonin then is one of the things that converts into serotonin. Later, I'll talk about anxiety in terms of serotonin and dopamine and stuff like that. A lot of times when people spend a lot of times on a screen, they get depressed. And so one of the things is melatonin. That's what I talk about in the screen sickness. Taking a man, which is anywhere between 2 to 6 drops of this melatonin. It's relatively cheap stuff too. Doesn't taste bad. It's great. A woman can take up to about 12 drops. Melatonin is one of these. It's known as an antioxidant. It's known as one of the very few antioxidants that can cross the blood-brain barrier and rebuild the brain. Basically unhack the brain. And if you really knew what these blue lights are doing to our brain, as well as all of the stuff that they're putting in, you've got to know that they're hiding images and flashy stuff and on all the commercials and all this stuff. This is mind control. And our brain, you feel it. Many times people go, oh man. And even too, just the screen has what's called a flicker rate. It flickers 25 frames per second or more. And if you, let's say sometimes let's say an old video camera that takes a picture of like a TV screen, on the video you can see it go wah, 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 but your eyes don't see it. But your eyes do see it, and your eyes pick up on it. If you're under fluorescent lights a lot, this is programming your brain. So melatonin is something that can actually help to unhack your brain and get you to produce, because see, the blue light is getting us to stop producing melatonin, and our brain cannot work correctly. Another thing is these blue blockers, which is these, whether it be a reading glasses. Sometimes they make a non-reading glasses. It's a non-prescription strength that has what's called blue blocker technology. The e-readers, I forget who makes them, but it blocks the blue light. And a lot of times when people are dealing with insomnia, it's because they were watching a screen right up to the moment that they were to get bed. So if you have to watch a screen 3 hours, the rule of thumb is stop watching anything. If you want to have a good night's sleep and repair your brain and repair your whole immune system, stop watching any screens 3 hours before you go to bed. And if you absolutely have to, make sure you have blue blockers on. Make sure your screen, like on my computer, you have which the nighttime mode. Nighttime mode actually changes the wavelength, so that's helpful. Another thing that's really, really helpful for the eye strain and screen strain and stuff like that is Tranquinol. Tranquinol is these herbs that you can take to help to fall asleep. And last week I talked about them. Let's say you're nervous about going to a meeting, or you're nervous going to the dentist or the orthodontist. You can take it right before, and it helps to calm you down without making you drowsy. But the real reason is because it's unscrambling your neurotransmitters. It's unbreaking your brain. Anxiety. Okay, if you listened last week, and I'm going to talk again, I'm just now getting into, and I don't know if I'm going to do it next week, but I'm going to do a whole show on these amino acids. Now, remember I talked about anxiety, that Germany really found they made the B vitamins. So a B complex deficiency mimics or is what these things would be. It's the underlying cause for many mental problems, including, the straight out real bad ones that you have to be on drugs for or get put institutionalized, or Prozac or something like that. So the natural remedies, but now I'm telling you, proof positive, I've used amino acids, and I've used everything, including the hemp that I will talk about, which is for anxiety. It helps with the Endocannabinoid. Nothing was working, but when I went to the amino acids. Now, for me, it was L-tyrosine. Now, amino acids, what are amino acids? Amino acids come from proteins that we eat. There are foods that have, but what amino acids are is they help us to make proteins. And a hormone is a protein, and an immune system is a protein. Meaning, you have to build inside your body for everything, every essential thing in life, but especially the things that you're coming to me about, or when you feel it, when you've got anxiety that's related to not having enough of these neurotransmitters, not enough serotonin, not enough dopamine, the reward, and too much of the bad ones, then you can feel like you're in deep doo-doo. And it can also totally affect your whole metabolism. That's why people, when they get depressed, they can gain a lot of weight. And then when people, let's say, are manic and are just like a little, it's bad for their heart. Because you can go, so let's say thyroid, a lot of times when people are dealing with, let's say, when a person is, overweight and they go, oh, it's my thyroid, I got a thyroid condition. So that's true. It is true. It's not an excuse. It absolutely, but see, they've been using a lot of the things that have been used for this in terms of anxiety leading to metabolic stuff is the real answer are these amino acids. And again, if you can build your own factories, your own stuff, that's the answer to everything. And amino acids are the things that are behind all of it. And so, and this is still in its infancy in terms of even people who are really good at helping people with anxiety and brain issues. There's still not a lot of experts who even have really tapped into the amino acids, because it's hard to think of an amino acid, just like it's hard to think of a simple essential thing like a salt being a panic attack. A lack of salt is a panic attack, or a lack of tyrosine, or a deficiency in phenylalanine, or this new one that I'm starting to use. It's what's called selenomethylthionine. Long words and stuff like that. But this is selenium. This is, again, and sulfur-based amino acids. Our body needs the right type of this stuff in order to make the factories that run everything in the background that we want, which is, again, like I said, your immune system. If you get exposed to, let's say, a virus, you better build the B cells or the T cells, whatever it takes. You better build these war machines to go out there. You have to make them. They have to be assembled by your body. And without the right amount of amino acids, you make bad ones or you don't make ones. So when we talk about the immune system in terms of rebuilding the immune system, these are essential. And when we talk about brain chemistry, this is, it's wow. The canary in the coal mine here is these amino acids, and it makes such a dramatic difference. I had such a huge difference between my level of anxiety for the past couple of weeks and going on the tyrosine, and now I'm trying the selenomethylthionine. The thing that is great about them is there is no harm from if they don't work, they don't work. Again, it's an amino acid. And again, I'm afraid of these pills. Well, you're eating amino acids. All of these amino acids are in all of the foods you eat, especially the protein, the vegetables, everything. That's what is the amino acids. Now, the thing is when people are in high stress levels, you're using up these factories. And so then you cannot produce, let's say, the dopamine, the serotonin, the norepinephrine, these happy hormone things, and then you produce too much of, let's say, cortisol and homocysteine and all this other stuff that are inflammation, pain, as well as just, I feel like I'm just stressed out, right? So later I'm really going to get into this because I've always known about this, but I didn't have firsthand knowledge with myself in terms of how dramatic these things can be. Let's get into back pain. A lot of times when people have back pain problems, like for instance, it's the back pain that where you're sitting in the car and then you stand up, oh God, the back pain. It was all right when I was sitting, or let's say it hurts when you're sitting. Always go to the quads. The quads, what are the quads? The quad muscles are your leg muscles. So the quads are the ones that your thigh. Your thigh muscles are the ones that are in the front. Your hamstrings are the ones that are in the back. And a lot of times what's happening is your thigh muscles, your quad muscles are tight and it's tipping your pelvis, which is then arching your back. And then your back muscles are fighting that, going, hey, wait a minute, no, get back here. And so a lot of times it's caught in this tug of war, and your low back, especially the discs, are getting compressed. So a lot of times, one of the first things when you're dealing with back pain, do a quad stretch. What is a quad stretch? Is that where you grab your heel, and you can do this while you're sitting down too. And literally, it's geez, I did it. start to get a cramp. So that means I need my magnesium. Be careful of that. You can get a cramp. One of my favorite ones to do is actually a wall stretch. So you basically put your hand up against the wall and then just try and pull your heel to your butt. That's stretching your quads. Another thing that's really good is a wall stretch, which is you basically lean up against a wall and you put your back, and then you get into like a squatting position, like you're sitting in a chair without a chair. And then you actually engage your quads. You turn, so that makes your quads work. And then you lean forward and stand up. And a lot of times when people have that back pain, that's like that sharp, like, ooh, wait, man, that really hurt. Immediately go up to a wall. Again, and then a lot of times you can do it this way, which is stick your arms straight up. And your legs will start to quiver, right? Start to quiver. So you're only going to do it for literally a couple seconds, up to maybe 20 seconds. And then what you find is that when you go to stand up, that back pain disappears. Like, oh, wow. So that tells you if it's it's a spasm. Back pain where it's a spasm like that, immediately go on some magnesium, or take that Epsom salt bath where that helps to relax those muscles. A lot of times back pain actually is kidney pain. So it's referring from your kidneys are drying out and your kidneys are using these muscles to squeeze them to help them. So it's kind of like, hey boys, come on over here and help me. So for that, the kidneys, we can use the Renoven. Now, I also going to refer you to for kidneys, one of the best thing you can do, I have a video that on my YouTube station, Jason Eagle QRA, and that one's how to get rid of kidney stones. And within that, I tell you how, like drinking distilled water and blah, 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 but also the russet potato juice. I do it on the video and I show you how to do it. The potato juice is like that lime scale remover, like when you got, like, say, rust on, let's say, a sink or toilet bowl, and you scrub it and nothing happens, but you pour that liquid called the Works on it, and it disappears, because that's getting rid of these mineral deposits. It's like an acid to a base. And what it does is the potato juice, the russet potato juice, has just the right amount of that stuff. And when you drink it, it will get into your system and it will dissolve. So a lot of times when the kidneys are, let's say, starting to get sand, starting to get stones, you'll get back pain. So the russet potato juice helps with that a lot. Bleeding gums. People get the bleeding gums, or the dentist has said, you really got some gingivitis here. The bad breath that's coming from these teeth and you floss it and it doesn't help. Here's what you should get. Get a water pick or a water flosser. Everyone should have them. And again, my wife was like, I don't know why I resisted it so long. She has braces and now she has to, but she loves it. And it cleans like so much better than what a flossing can do. And again, you're trying to brush your teeth to get stuff off your teeth, but the big thing is just maybe the food gets jammed in there or the bacteria is in there. So you can use just straight water to shoot this stuff out of your gums. But then you can also use salt water. Now, salt water will kill these bacteria and these microbes that are anaerobic microbes that are living inside the gums. And let me remind you, periodontal disease has been associated with one of the leading causes for heart disease. Why? Because these bacteria get in the bloodstream in the teeth and then directly go to affecting the top of the heart. These bacteria are eating your heart. So, and then we can also, in that water, you can put, let's say, water and hydrogen peroxide. Why? Because hydrogen peroxide is oxygen. And these guys are what's called anaerobic. They don't like oxygen. So if you feed them oxygen, it will kill them. And then going back to what I said before about, let's say, the sinuses, the xylitol. The xylitol has been known to kill what's called the caries dental. The caries is the type of bacteria that causes tooth decay. Right? But then we've got tooth decay deep inside the gums that you can't brush away or floss away. So you squirt this water with the xylitol in it, and what it does is it cleans it out, but it heals it. And I've had people who their dentist said that they had these dental pockets that were deep enough they were going to lose their teeth. Let's say a 5, a 6, up to a 10 millimeter pocket. You do this water pick method for about a month or two. You go back to your dentist, and they're perfect. I've had people the dentist go, that was amazing. Like, how did you heal it? But again, it was the water pick, but the secret is putting these things in the water: salt, hydrogen peroxide, xylitol. You don't put them all together. One time you do water, one time you do salt and water, another time you do hydrogen peroxide and water, and another time you do xylitol and water. And you just kind of mix it around. And after about a month, you will see. My last one, which is immune system reboot. Everyone's worried about going back to school. So if you're a teacher that's going back to school, or you're going to send your kids back to school or whatever, which is, I don't want to catch something. What's an immune system reboot? Number one, colostrum. Colostrum, this comes from cows, bovine colostrum. It's the very first milk that comes out of a pregnant mammal. And it is an immune system. If we're talking about immunology, which is when you develop immunity to something, you're developing it through the B cells or the T cells. Now, if you wait for your body to respond to infection to build the T cells, sometimes it's too far along for it to work. So your body can't build enough T cells fast enough. Now, you can take T cells. You can drink T cells. So your body doesn't have to make them. That's what colostrum is. It provides active human immunoglobulins, IgG, all these different immunoglobulins, and you can swallow it. It is an immune system in a pill. So it means when you take it, any human being, it immediately is, you're swallowing T cells, that's a great thing if you are going to be exposed to something and you're worried about it, because if your T cell response is already on, if the cops are in the area before the burglars show up, it's not happening. They're not getting in, right? So creating an immune system that's already there before you get into something is what's called a prophylactic, meaning it stops it before it happens. So if you're going to reboot your immune system, the colostrum I recommend. I recommend the Immunovent. It's all these different immune stimulating herbs and things like that. Zinc. Basic vitamin C, zinc. Another one of my videos is I did what's called the Zinc Challenge. And a lot of people like to watch it because I make some really nasty faces. Because if your zinc levels are good, it tastes horrible. If your zinc levels are not good, it tastes like water, like nothing. That means you need it. And most people that take the zinc assay as the liquid, they're like, it's like water. It's like nothing. Well, that means you need zinc. Zinc is one of these essential nutrients. It's a mineral, okay, that is essential for your immune systems as fuel, as your immune system has to get paid. Vitamin C is always, again, more vitamin C, especially this one that we know. We know the vectors that it works. The vitamin C helps with it. The zinc works with it because it stops how these ones get in. Each burglar, each virus has its own particular. And this one that we're experiencing now, everyone's afraid of, is related to the same as the SARS. It's also related to one of the other COVID ones, all the different COVID ones, but it's also related to the HIV one. The HIV is a virus, and it gets into the cells through a certain key lock. Well, the thing that has been proven to stop HIV getting into the cell, as well as the COVID and all these other ones, is the chaga mushrooms. Natural, there's drugs that they can do it, but what works better without any side effects is the mushrooms. There's a particular mushroom called chaga mushrooms, which you can take as a pill. You can, they're just these ground up chaga mushrooms. You can actually brew it as a tea. The fermented mushroom that I have, which is you just put a couple scoops in some water, that works. And as long as that's in your system, if you get exposed to these viruses or these infections that get into your cells through this particular pathway, they're blocked. They can't get in. Another thing that really is a great antiviral is the amino acids, the L-lysine. There's a whole diet called the antiviral diet, which is foods and supplements that are high in lysine and low in arginine. Arginine is, we need that for muscles, but if you're trying to fight off a virus, when you increase the levels of lysine, amino acid in your system, they can't get in. And if they're in, they can't get out. It's amazing how our body is designed this way. I guess I got one more, blood pressure. One of these things, if a person I just took my blood pressure and I'm up to 140 over 90 or so that, or 130 pre-hypertension, 130 over 95, something like that. What do I do? Again, if you don't have a cardiologist and they tell you baby aspirin, they're starting to go back on that. It's not the best idea. You know what's a great idea is the fermented beets, because that produces nitric oxide. And I know so many people that were having their blood pressure spiked up. They checked it. They took 2 scoops of the fermented beets, drank it in some water, and within 2 hours, they were back down to normal. Because the more nitric oxide you have in the system, now your vessels grow. And they don't, because most of the high blood pressure is the pressure on actually the vessels. Deltanol, you can take, let's say your blood pressure is high, vitamin E or delta-tocotrienol, 2, 3, 4 at a time. You will watch within an hour. Or let's say this is a great one for a pre-workout. Let's say a person really wants to get a great workout. Take about 2, 3 Deltanol before you work out. Your endurance goes through the roof because you can get more oxygen. 2 things about blood pressure: resveratrol. You can take that one, and then magnesium. Always magnesium. It's so helpful. This is Jason Eagle, your Natural Health Authority. I know it was a whirlwind, and this is only part of my page, but until next time, bye-bye.